You guys, welcome. This is an interactive exercise that you're going to be doing with Ron. Just to give you a little background on Ron Remy, who is a good friend of mine and someone that I very much look up to. Ron is a serial entrepreneur. He is founding CEO of Mobile Heartbeat. And so, I mean, Mobile Heartbeat is the industry standard for hospital worker communication, and it has streamlined and made everything so efficient. And Mobile Heartbeat has been credited with saving countless lives. He's also a senior executive at HCA, which is Hospital Corporation of America, the largest hospital group in the US. So this is a big deal guy right here. I'm very excited to share Ron with you guys, and for him to share his knowledge and experience and advice with you guys, and to work with you on how to create, a streamlined, efficient business. So Ron,
Awesome.
I will let you take it away. Thank you.
Awesome. So first of all, Alicia, thank you. And for those of you attending today, thank you for taking time out of your day to spend it with me. I'm going to make this as interactive as possible. So when you jump in, I think you're going to have to unmute yourself. Are they able to unmute themselves on demand?
Yes.
Fantastic.
So upon entry, you guys are going to be muted, but make sure that if you want to join in, that you've got your hands ready to click the unmute at the lower left-hand bottom of your screen, or you can go ahead and also, I think, hit the space bar, and that will temporarily unmute you as well, and then put you back into mute.
Awesome.
We also have the chat, and I'll be, just in case, because I have had Zoom quit on me twice today when I was using the video. I will probably turn that off intermittently while we're doing this, especially while you're screen sharing.
Okay.
I don't cut out since I am the host. And then, if you guys want to send in questions via chat as well, you're more than welcome to do that, or comments. If you guys want to raise your hand, if we're asking you to join in, and you want to do that, you can raise your hand by opening the participants little section at the bottom of your screen as well. And then over to the right, you'll be able to see raise your hand. So I think that's it. Ron, go ahead.
Outstanding. All right. So what we're actually going to do here together as a group, and I see Alicia and John on here, so I might even call on them at some point. I hope they don't mind. I use the Socratic method, so I may be calling out to people to answer questions. And it's not that I'm trying to embarrass you. I just want your thinking, and I want to hear about you, what you have to say. So what we're going to do together is we are going to try in a very short period of time to come up with a new business idea and actually figure out how we might build a business around an idea. And here's the idea. And one of the great things that I've learned over my career is crises like COVID-19 enables creative new ideas to come to the forefront. There's nothing, never let a good crisis go to waste. New things always come out of crises because they have to. So I'm going to put a problem out for everybody here, and we're going to walk through this together and see, just how we're going to do this. So the problem I'm going to put out is, can we eliminate the waiting rooms, predominantly of hospitals first, since that is the easiest, but then we might want to think about doctors' offices, physical therapy offices, urgent care facilities. Can we build a business that eliminates the waiting room? And there's an obvious reason to eliminate waiting rooms right now is they're full of sick people. And the last thing you want to be doing is putting a bunch of sick people in the same physical location when we're in the middle of a pandemic. So think of the future of the waiting room, every place that there's healthcare, hospitals, clinics, physical therapy. Can we build a business around that idea of eliminating the waiting room? So what we're going to do here is, here's our agenda. First question is, why do we have waiting rooms? That's number one. We're going to ask that question. And number two, what do we do when we need to get rid of them? What do we need to do to get rid of them? What do we need to get rid of them? Right. Three is, who would benefit if we did this? It's obvious in some cases, not so obvious in others. And how would we get, the last question, how would we get those that would benefit to use our idea? And I'm a software person. I've been building software most of my career, and this may have a software component to it, may have some cool technology, but it might also have a people component to it too. We might do some things manually by hand. So we got to think about that. Not every problem is solved by writing an app for a smartphone or by writing software. Sometimes you need people to solve a problem. So we're going to put all of this together. So with this as the agenda, I'm going to ask the first question to the team here and see if we can get some interactivity going. Why do we have waiting rooms? Why did they exist? And I'll type if you guys brainstorm a little bit and jump in of why does a waiting room exist? I'm sure you've been in one. Every single person here has been at least to the pediatrician's office at some point in their life, and they've had to sit in a waiting room. So why do they exist? Why take up all these sick people and put them in one room together? What do you think? I'm waiting for somebody to unmute and jump in. My first participant here. And don't ask me to call out and do this because I will. So I want somebody to jump in and say, oh, I see Kevin just unmuted. Go ahead, Kevin.
So I think it's a twofold reason. So one of the reasons is that the doctor can only see so many people at a time, right?
Yep.
And so they need to wait for him or her to become available. And then another reason is to have somewhere to fill out all the paperwork and stuff that you need to fill out before the doctor sees you.
Paperwork. Good one. Paperwork is critical. All right. Anybody else? Why do we think we still have waiting rooms? Anybody else? Those are two really good ones. A doctor can only see so many people at a time. And the second one, paperwork is critical. Every time you go into a doctor's office, you're filling out privacy form, you're filling out your medical history, you're filling out if your address has changed. Really good point. Why else do we have waiting rooms?
Arnab, it looks like you've raised your hand.
Yeah, so I would also say that it's because we need to keep track of all the patients, let them in, and also insurance companies need that information so that they can bill the hospitals or the patients.
So keep track of all patients for billing and insurance. Excellent. Why else? Anybody else have a thought?
It looks like on the chat, Shasti said urgency, so that urgent cases are treated faster.
Oh, urgency. So put people critical up front. Excellent. Excellent.
It also could be pulling up records on the patient.
Pulling up medical records. Is that it?
Yes, which would make it more efficient for the doctor. He would have more information, past history information.
Make it more efficient for the doctor. All right. Anybody else? And I'll give you a couple other thoughts that why I think they exist to add on. These are all excellent, by the way, and they're all definitely a reason why we have waiting rooms.
Mm-hmm. And going with number one, I think that also improves the efficiency of the doctors, having people ready for them. So as soon as they're ready for a new patient, they can go ahead and take them. So when doctors get behind schedule or what have you, they can go ahead and just grab whoever is ready.
So I'm going to come back to this. Remind me to come back to this, but I'm going to throw out one other idea of why we have waiting rooms. And this is the one thing I've learned in business. When I ask a question, well, why do we do something? The answer is often, well, because we've always done it that way. Why do we have waiting rooms? Because, well, we never had a reason to eliminate them before. And now here we are in a pandemic where, oh my gosh, all of a sudden having waiting rooms isn't such a good idea. 150 years of hospitals and doctors' offices with waiting rooms, and all of a sudden now it is a problem. It is a problem. So I'm going to list this last item down there is because we've always had one. Just because, we'll call this just because they've always existed, right? So a lot of times in business, you're going to see problems of you look at it and you go, well, why is this happening this way? And the reason is many cases because it's always existed. Before I leave this slide about why we have waiting rooms, I want to hop up one to the efficiency of the doctors. So when you go to a waiting room today, do you know before you walk in that door if the doctor is running ahead or behind schedule? Do you have any idea? Has anybody ever heard from a doctor or a hospital or a clinic that said, oh, you know, we're running behind schedule, why don't you come in a half an hour later? Anybody?
Yeah, that's happened to me.
It has.
Yeah.
Nice. So, and how did they let you know? How did they tell you? What method did they use to tell you they were running late? Phone, text,
Email.
email?
How did they let you know? Phone? Just says by phone.
Yep. Phone, email, text, right? Directly to you. This is going to be a big part of what we're going to do here. All right. So we've got a problem, and we see the reasons why the problem exists. We see why there are waiting rooms. Doctor can only see so many people at a time. They are the gateway. Could also be a nurse. Could also be the equipment in the lab. Paperwork is critical. You always have to fill stuff out. Need to track all the patients and make sure the insurance is done properly. Urgency, this is a really good one to make sure we put the critical people who need to see the physician up front, put them in the front of the queue. Pulling up medical records makes it more efficient for the doctor to have them in advance so that when you walk in to see the physician, they know all about you. They don't have to go research you. And the efficiency of the doctors, they're kind of the critical resource. When they get behind schedule, everything gets jammed up behind them. Everybody's got to wait because they are the reason you're there. And mine, just because they've always existed, but there seems to be a trend, and I'm going to put this in a little bit different color. This is something relatively new, which is great, is that people are actually letting you know, physicians are letting you know directly to you the proper time. This is a really good thing for us to consider going forward. All right, so we're going to move off of this slide for a second. We're going to come back to this a little bit later, but I want to go to the next in the presentation, and that is if we are going to solve this problem based on everything we just listed here, why waiting rooms exist, what are all the different pieces that have to come together? And here's what I believe has to come together. I'm from this industry, so I see these pieces. I have a little bit of inside knowledge here, but the first thing is, if you're going to eliminate the waiting room, you got to get the patient there just in time before the doctor or the practitioner or the nurse or the lab equipment is ready to see them. So if you're going to eliminate the waiting room, you've got to eliminate the patient's need to wait. And that means the patient has to get there just in time so that when they walk in the front door, they are ready to go see the physician or have their blood drawn or go into therapy, physical therapy, whatever it is. So we need to get the patients there just in time. The second thing we have to do is we've got to figure out when the doctors are ready for the next patient. And it was a great comment from the individual that said, oh, I got a warning that they're running late and I should show up a little bit later. If we know that exists, that capability exists today, we can tap into that and we can figure out how we know that the doctor is running late so that we can call the next patient when the doctor is ready and not have the patient wait. The other part of this that most people forget is that there's another component in most healthcare facilities, and those are nurses. And generally, there's a sequence where you deal with the nurse first and the doctor second. Now, that doesn't always happen, and in some cases, you don't see a nurse, and in some cases, you don't see a doctor. But don't forget the nurses. You've got to consider them. What's their schedule look like? How busy are they? Are they running behind, or they have plenty of time for you? And then the last piece of this is going to be the lab or equipment in the hospital. And this comes with scheduling tests or x-rays or ultrasounds or all of the equipment that might be needed for your visit. And it's dependent on what your illness is or what your chief complaint is, we've got to schedule all that stuff at the same time. So this is a complex problem, is you've got 3 people items, nurses, doctors, and patients, and 1 physical item, the lab or the lab equipment, the availability of the room, the availability of the equipment. And all 4 of those have to come together in order for you to have a hospital visit. So our goal here is going to be to figure out, if we build this company, how can we get all 4 of these pieces of information to take place at the same time so the patient doesn't have to wait. The patient walks in the door, the nurse is ready to visit with the patient, the nurse hands the patient over to the doctor after performing any preliminary tests, any lab equipment is ready for them, the x-ray machine is ready for them. It's efficient, in and out. If we can solve this problem, well, we could get rid of the waiting rooms. All right, I'm gonna stop for a second, and I'm gonna take any questions that might pop up, and now we're gonna start starting to design a little bit here. So any questions about what we've done so far before I move on to the design part of this? And I can't see hands raised, so Alicia, if you jump in seeing hands raised and help me, that'd be great.
Absolutely.
No questions? Go ahead.
Absolutely. So no one's raised their hand yet, but if you actually want to hit the participants button, all the participants show up on the side there, and then you can also see when they raise their hand.
Oh, I see.
Yeah, so do we have any questions? Feel free to unmute yourself or to use the chat or raise your hand.
So I'm in gallery view. I can see everybody at this point on my other screen. That's why I'm looking to my left. Okay.
I think we're good.
All good. All right, let's move on. Now, this is where we got to do a little design. And before we jump into this, one of the basic premises of starting a company is don't redo something that's already been done. In other words, don't waste your time, money, and effort building or doing something that already exists. You want to add, you want to do new things. Now, you may be combining in a different way things that already exist, but don't duplicate something that's already been done. You're going to waste your time, you're going to waste your money, and you're going to be really unhappy with the results. So with that in mind, I'm going to ask a question here to the team. Whoop. I'm going to go, let's see. We'll go into one more. There we go. All right, so let's brainstorm a little bit, and I'm going to come out of this. I'm going to start typing. So we got to get the patients there in a timely manner, right? How do patients get, let's take a hospital. That's the easiest thing for us to use. How do patients get to a hospital? And this seems trivial, but it's not. How do patients get there? Floor is open.
They can get there through an ambulance or through their own personal car.
Ambulance, personal vehicle.
Or if they're close enough to the hospital, they can walk there. And if their condition isn't too serious.
Walk.
Well, they also could get there virtually via telemedicine.
Ah, telemedicine. Yep. Which is relatively new, and it's become a lot more popular over the last couple of weeks because people really don't want to be in those waiting rooms, right? So we're going to come back to this in a second. How else can I get there?
Andrew?
They can also take like public transportation.
Very good. Public transportation. So we're going to actually think about, you know, how we're going to make the biggest social difference with our idea and impact those that are most in need. And basically, we're going to look at those that don't have some of these other options. So that's a really good point. And there's another one, friend or family member drive them, not just their personal vehicle, friend or family member's vehicle. Right? So those are basic ways to get somebody to the hospital from wherever they are. So we're going to strike this one. We're going to highlight it right now because we're going to focus on the problem telemedicine is great, but there's plenty of choices out there right now, and they're coming up every day. So we don't want to duplicate something that's already been done. So we're going to make the assumption that what we build, we're going to restrict it, has to be for people that are going to be in the waiting room. In other words, they have to physically show up to what used to be a waiting room. They have to come in for a physical test, or they have to come in for a physical checkup, or they have to come in for, have their blood drawn from the lab, or they have to come in for a procedure or an operation. So we're going to take telemedicine out of this because we don't want to compete with all the new cool telemedicine stuff that's popping up, because basically we can't duplicate that. We don't have the resources to duplicate that. They're further along. So we're going to take a look at all of these here. The first one up top, ambulance. The great thing about an ambulance is they have something that is tied in directly to the hospital. So if you're coming by ambulance, the hospital knows exactly when you're going to arrive. And my software is a great example of that, is it's used for the ambulance to tell the emergency department exactly when they're going to show up and what the patient's condition is. So we're going to take that out of our equation. So we're not going to work on getting people there by ambulance, but we are going to work on all the others. Personal vehicle, walking close enough is a good one. Public transportation, and friend or family's vehicle. So we'll put these two together, or family friend vehicle. We'll add these two together. So now we got to focus on these different ways. We've taken out the yellows. We've got 3 left over. So remember when I said that the best thing we could do is not take advantage, is to take advantage of something that already exists and not duplicate big effort, right? We want to use our time and energy effectively. So that begs the question of who has the toughest time getting to an appointment, and how can we figure out the best way to get them there and how long it will take? Because we want to build a successful business, but at the same time, we want to make the greatest social impact with our new idea. So if we go back up here to our problem, personal, walk if close enough, public transportation, we're going to rule out ambulance and telemedicine because that problem's being solved. Who has the toughest time getting to an appointment? Of those folks going these 3 ways, personal, walk, or public transportation, who has the toughest time getting to an appointment and why?
Well, walking probably because they may have a healthcare condition.
Walking due to a healthcare condition. Okay. What do other people think? Does everybody agree to that?
It could also be a public transportation because they're like, you don't know what time the transportation is going to be there and if it's going to be available immediately.
Yes. If I am someone that doesn't have access to walking because I live too far away, I don't have a car, I don't have access to a friend or family's car, the only other way I can get into the facility to a hospital is by public transportation. And the problem is really a tough one if I have to solve it myself. I don't know when it will be available. I don't really know what exactly to do to take advantage of public transportation. I need some help figuring this out, but more importantly, even if it is available, even if I can get to it, how do I know exactly how long it's going to take for me to get from my home or my business or a friend's home to the facility, right? Because remember our problem, we've got to get the patients there so that they don't have to wait. We want to get them there right on time, right when the doctor's ready, right when the nurses are ready, right when the lab's ready. So now that's going to take me down to this real question is, okay, walking in public transportation, will it be available? How long will it take? how can we figure out the best way to get them there and how long it will take? All right, so this is where I did a little investigation on my own. I don't live in Phoenix. You all do. You live in the area out there. You know your city so much better than I do. So I'm a complete beginner when it comes to solving this problem. But I don't want to invent a solution of figuring out how long it's going to take. Is there anything out there available that I could build my new idea around, that I could take advantage of so that I don't have to start from ground zero? I could actually use something. I spent about a half an hour poking around today, and I came up with this. Valley Metro, plan a trip. So let's plan a trip. I'm going to go from 5959 West Brown Street in Glendale, which is right there. I'm going to go to Banner University Medical Center on McDowell Road because that's where my appointment is. It's right there. I want to get there at, let's see, 4:30 p.m. on Thursday the 18th. And if I click on it, at least I hope if I click on it, there it goes. Here's what I get. I get the best options all done for me. I get exactly what buses. I get 1, 2, 3, 4 choices. The time it takes to walk, between all the buses to make sure that I'm able to be ambulatory from my place to mass transportation, and exactly where to pick it up. So now if I'm building a business around this and one of my customers, a patient calls in and says, I need to get 5959 Main Street, Glendale to Banner Health, I can instantly look at this website for the patient or write a software program that looks automatically, and I can figure out exactly how long it's going to take the patient to get there. So if we do a little bit of math, if we had to get there, the patient by 4:30, and it takes an hour and 37 minutes. Notice this is the most efficient route down here at the bottom, and it takes 3 buses, non-trivial. An hour and 37 minutes, I don't want the patient to have to wait more than 5 minutes. So I'm going to go backwards. My software or my people running this company with me, we're going to work backwards for an hour and 42 minutes and tell them, hey, you need to get this bus, the number 59 bus, 1 hour and 42 minutes between this appointment. So, oh, by the way, I'm reading this a little bit wrong. This is the different times that are available at different times a day. So the hour and 42 is the most likely one now because that's when we need to get there. So this is what we're going to instruct the person to do. But where I'm going with this is that we are clearly able to use somebody else's technology to our benefit. This is Valley Metro. It's available to everybody, but I bet none of you actually have been on this website before. I could be wrong, but I could figure out how to get anywhere in the Phoenix metro area by mass transportation just by going to this site. But that's only one part of the problem. So let's go back now to our challenges here. We figured out public transportation, but what if it was personal, friend or family, and they're driving? Can I figure out when they have to leave in order to get there just in time if they're driving? So back to our problem statement again, how do we figure out the best way to get them there and how long it will take? Again, I went searching around and I found, let me draw this down here just a little bit. Driving times between different points in Phoenix. I picked the exact same place, 5959 West Brown Street, Glendale. Here's Banner University Medical Center in Phoenix. I can tell you that it is going to take me this amount of time to get in between these two. 25 minutes is the optimal time. So if my appointment was at 4:30, they should leave with a 5-minute grace period at 4 o'clock in order to follow this route and get there. And I know exactly the route that they should take. So I could have somebody sitting in my customer center that if a customer called, said, I need to make my appointment at Banner University Medical Center by 4:30, what do? My questions would be, are you going to be taking your car or a friend's vehicle, or be taking public transportation? If they give me one of those two answers, I could then say, okay, here's exactly the time that you need to either take this bus, or here's exactly the time you need to leave your home with your car or your friend's car to make your appointment and not sit in the medical center. So we didn't write any software. We just found existing technology that would help us solve this problem from the patient's point of view, right? We took this problem from the patient's point of view and went, can we build a business around this that would really, really help them? All right, let's stop for a second and see if there's any questions, or if you think I'm crazy, or if you think I'm wrong. I love a good debate, so open it up if you want to debate. You all believe me.
Yeah, no, we have Arnab raising his hand. Go ahead.
Well, it's not that I don't believe you. It's that what I'm thinking is, are we only considering times when these patients have to get somewhere for an appointment? Or are we also considering if they have an emergency as well?
We're going to focus on the appointments, because the emergency, if we remember the case of an emergency, we go back to my screen here, the emergency is likely, not always, likely going to be done by ambulance. And if it's by ambulance, then we would have the ambulance knows exactly when it's going to get there. So that problem we're not going to address. And if someone calls us and says it's an emergency, what do you think we should do in that case?
Tell them to call 911, I guess.
Exactly, call 911, because they need to get there via professionals that could administer some care en route. So they really need an ambulance. They need to call 911. So
but my concern would be for if taking an ambulance is too costly for the person who has this emergency.
Okay, that's a great point. You're going to come up with the second solution to what we're going to be doing here. So think about that as a problem. When we get to the end of this, I want you to come back and go, okay, I think I might have an idea around my scenario of the ambulance being too costly. You ready for that? I'm giving you, that's a tough challenge. That's not simple. You might not have an answer when we're done here, but it's a good puzzle to pose for this team. See if we can come up with an answer.
Okay.
Excellent.
One issue to consider is using software that's local versus national, and that you may have, like Valley Metro is for Phoenix, and it may be better to integrate with software that's national.
That is a great point. In my search, I couldn't find any software that was national. I could only find localized software on a city-by-city basis. I looked at 3 cities and I was able to find this same technology of being able to figure out when mass transit would get you someplace and the best way to go pretty easily in each city. I think you might be able to do it with Google, but I'm not a big fan of Google, so I didn't look there. So that might be an exercise for the rest of the team here, that you may be able to solve the national problem with Google, but I chose to do it local because I know you all live in Phoenix, so I looked there first. And that's the part of starting a business, is you do your exploration. Is there a national solution that would let me apply my puzzle solving skills across the whole country? Or do I have to do it locally, one city at a time? Really good question to answer. And I'll pose that to the team is, and when we get to the end of this, is do you think this has to be city by city, or are there national solutions? All right, anything else? Go ahead.
Well, I was going to say, well, when people call in to make their appointment, that could be a time where, you know, they discuss, okay, how are you getting here? And will you be able to get here at this time? And is it a convenient time for you? You know, you could always build that integration to text them that information directly, so that they could, you know, have it directly on their phone, pull it up and make it a little bit easier for them, as well as, you know, we're running half an hour behind. So, you know, if you are walking or taking public transportation or just driving, you know, you can wait in your car or wait outside, you know, or just time that in a more efficient manner so that they're not, you know, sitting in that waiting room.
Perfect. Perfect. All right. So I think we've got a pretty good solution of getting the patient there in a timely manner. We've figured out how we could get access. Go ahead.
Kevin has a question.
Oh, go ahead, Kevin. Sorry.
Yeah. So, maybe I missed something, but I don't really get it. Like, how is this an idea that could be a business? I don't
We're going to
like
get to
you.
that. We're going to get to
Okay.
that. Let me get a few more slides along and we're going to get to that in terms of a business. Because a business needs somebody to pay for this. How are we going to get somebody to pay for this? And there's a missing
Okay.
piece that we got to figure out before we get them to pay for this. All right? Stick with me, Kevin. I'm going to come back to you. Okay. So we got the patient side somewhat figured out. There's existing technology. They could call into us or they could type into our software how they want to go, mass transit or car, what time their appointment is and where it is, and we could guide them the best way to get there and what time they need to leave so that they get there just in time. There's no waiting room. But if we go back to our problem here, we've only solved this piece, the patient so far. We got these problems to still solve to build a business. And this goes to you, Kevin. That really isn't very interesting. Anybody can go on a website and figure that out. How are we going to build the business around the other part of this? Because if a patient shows up and they still got to wait because the doctor, nurse, or lab and equipment isn't available, we're stuck, right? We haven't solved the problem. We've only solved one piece and we got 4 pieces to solve. And this is where it gets a little tougher, but it's not impossible. So let me go into presentation mode here for a second. And let me page down one. So now we got to figure out the other pieces. How do we know what else has to come together? We've got these 3 other pieces: nurses, doctors, and then the equipment. The equipment can be the examination room, it can be the x-ray machine, etc. Well, this is where our knowledge of healthcare and hospitals comes into play. Because what you have in every facility that I know of is an extremely detailed calendar of what has to happen for each patient. The lab, the physician, you can see down the bottom here, whoops, the lab at the bottom, new patient, follow up, their illness. This is just one layer of the hospital's scheduling system, their calendar, and it goes into great detail. This happens to be for an existing doctor, Ethan Banning, MD. You can see exactly when that physician is seeing each patient on its calendar and how long it's expected to be, whether there's follow-up needed, whether there's lab. However, have any of you ever seen this before I put it up on the screen, other than looking over the shoulder of the office administrator at a hospital or a doctor's office? Has anyone ever seen this before? No one. It's what I expected. The reason why you've never seen it before is that hospitals, physicians' offices, physical therapy centers really had no motivation to share this with you. Why? They wanted you to show up and wait in the waiting room. It was no loss to them if you got there half an hour early, because they're the ones with the critical time on their hands. The physician has to be busy all the time. They don't care if you wait for half an hour. They don't care if you wait for an hour. You may get unhappy, but they want to make sure that they're more efficient. So there's no interest in them sharing this information with you as the consumer or with our new business startup. However, out of every crisis comes opportunity, and COVID-19 has changed this. Now suddenly they're very motivated for you not to wait in that waiting room, because A, you're likely to get sick, but there's some other reasons as well we're going to talk about in a second. So now our challenge is, can we get the data off of the master schedule and add that into our business idea so that we can figure out when exactly a patient needs to get there? We solved the patient side. Now we got to solve the nurse, doctor, and equipment room side. And whoever mentioned that they got a text or notification that the doctor was running late, that is a great sign. That's why I asked that question, because now you know that that doctor's office has some capability to figure out, are they on schedule? Are they running late? And to let patients know. So if they can let patients know, our new company could get that information too and use it. So we have a challenge ahead of us. We've got to do a bit of research. First of all, we've got to figure out how easy is it going to be to get this information out of the hospitals, out of the doctor's offices, out of the physical therapy centers, so that we know exactly when they're scheduled to see each patient and how long is it going to be until they see them. In other words, are they running late or are they running early? And we've got to give them a reason to share that information with us. And we also have to keep it secure and private so that we don't violate any laws about patient privacy. This is where the problem gets a little bit harder. This is where our software skills, plus we're going to need some knowledge of how a hospital works to figure out how we do this. Do we have to have someone physically looking at the schedule at all times and whether they're running behind or early and inputting that into our software or our system? Or can we automatically pull this out of the hospitals, out of the doctor's offices? Because remember, we got to pull it for the doctor, the nurse, and the room or the equipment, the lab equipment. Do you think we could do that? I'll pose the question, and then I'm going to ask a follow-on question to see if you can really use your brain on why we could build a great business around this. Think we could pull it out? Who's confident they could pull it out? No one's confident. That's not a good sign.
Well, what if you gather a lot of information from the client, sort of a prompt system that would act as a virtual doctor where you're explaining your conditions, etc. And so, in a sense, you're providing information that's valuably needed to the hospital as well as saving a lot of time for them.
Exactly. So we're going to figure out why this has value to the hospital. You brought up some really good points here. We're going to figure out why it has value. And we're also going to do something that I think is super important coming up here. And this is the question that was asked of why is this a business? Is that really good businesses have something unique, have knowledge that's unique, or have something that's different that nobody else can duplicate. And sometimes they don't have it immediately, they get it over time. So for those of you that have friends out there that constantly run late, I'm assuming you do because I know a few of my friends that are never on time. How do you deal with that? If you've got a friend that every time you get together with that friend is running 15 minutes late, how do you deal with that? People don't care. They love having their friends 15 minutes late. Half an hour is okay. Hour is okay. What do you do when your friends are running late? You made an appointment to go do something fun together. Your friend is always a half an hour late. What do you do?
You tell them to be there like half an hour like earlier than planned. So
Yes.
when you're there, they're ready.
Yes. Or you can do the opposite, is you can show up a half an hour later than you said you're going to show up, correct? Because you know they're going to be half an hour late. So that's the special sauce we're going to build. Over time, for each of these hospitals and physicians' offices, we're going to get a sense of, are they running on time or are they running late? So we're going to know exactly when to send these patients from their homes on mass transportation or via their cars, because we will build knowledge about how the trends are of the physicians and the hospitals. We'll also think of this as like many airlines figure out what times are late or early for their planes. We're going to do the same thing for hospitals. Do they tend to keep their people late for 20 minutes, for an hour? Is it different at noontime versus at 10 o'clock at night? Is it different on days of the week? That is specialized knowledge that we're going to build through the data that we're collecting. And that's what's going to make this unique and valuable, because being correct and having this cool insight into what's really going on in these facilities is going to give us the ability to get patients there without having to put them in that wait room. The waiting room, we're going to make it go away. So this is where your creativity in your brain has got to go into figuring out, oh my gosh, what exactly should I tell a patient if they have an appointment at Banner Hospital at 4 o'clock on a Tuesday? I can physically see when to get them there by car or by mass transportation, but really, is that the right answer? Because this scheduling system, I know they always fall behind by half an hour every Tuesday. So I'm going to use my knowledge to do something really different and get them there on time. Okay, all this is cool. We've built either software or software with people that are chatting with my customers to get them the right information to get them there on time. But what the heck is the motivation to do this, right? So now we know how to get everything together because we're going to get this information out of the scheduling system. We know how to get the patients there on time. Our secret sauce is knowing exactly how accurate those scheduling systems are and tuning it based on our knowledge, days of the week, time of the day, how far away the people are. That's our secret sauce. But what we have now is, what are we going to build or make? What should our system look like? So first of all, let's take a look at the end user, the patient. What should it look like to a patient? What should it be? What are the ways a patient could possibly want to interact with us? Remember, we're focusing on, we're having the most social impact as possible. So let's assume that our patient population is likely not going to have an iPhone XR 11 in their hands. So what can we do?
You could call them.
Patient, call. Okay. What else?
Try emailing them.
Email. Okay.
You can text.
Straightforward text, the SMS, which is simple text, simple messaging. And go ahead.
Go ahead.
Nope, I'm listening.
Oh, okay. Well, the other thing I was going to say was that one of the issues is the paperwork, and that's one of the reasons we have the waiting rooms, right? Because they do need to fill it out. So we could offer them a link to go and enter in their information, their phone number, their email, all of that stuff, how they're going to be getting there so that they can receive the best routes, right, to get them there on time.
Yep.
And you guys could be prepared essentially for that. Having all of that information for them as well, already filled out, all of their, records and, what their issue is, et cetera, eliminates them waiting in the patient room, in the waiting room.
So that's a perfect example. And let's think of how we can be creative with that particular area, is the link to the paperwork in advance. What if, instead of having to wait in the waiting room and fill out the paperwork in advance, if we built this in a way that either the app or on a website, if they were able to do their paperwork in advance, we'd knock $5 off of their copay. That'd be a good idea? Do you think you would, if you could save $5 off your copay, would you spend 10 minutes doing the paperwork in advance? And maybe you all wouldn't, but we'll see. What do you think? Who would save $5 just by, you got to do the paperwork anyway, so why not do it in advance and make $5? Everybody or no one? No one. Okay, you guys don't need $5 for free for spending 5 minutes earlier than later. All right. Now you guys are easy. I love that.
Well, you could also provide them some input in advance of showing up.
Yep.
Because sometimes people want immediate needs. So if you have a prompt system, you've given your conditions, you could be given some advice, such as taking aspirin or something prior to showing up, because immediacy is important.
And Ron, we have some people asking if you can see the chat as well, because sometimes we're talking and we're moving pretty quick. So if you can.
All right, hang on here. How do I get to the chat? It's the one thing that I don't have access to in my screen currently because I'm sharing it. So let's see. More. Oh, I see chat. Here we go. Here we go. All right, so let me read through this. Slides. Sure, I'm happy to send you the slides. first of all, we talked about urgency. Yeah, let's see, we got here. Stop being friends with them, scheduling early, stop being friends. Very good. Call, yeah. Email. Okay, so I can see this. All right, so I don't think I have anything to answer on there, but let's finish the patient side of this. So we can call the patient and have a phone call. We can email the patient. We can send them a simple text. We could build an app with a link to paperwork in advance, and that also provides some conditions in advance, like take aspirin or make sure you don't eat before you come in, that sort of thing, right? So now let's look at what it takes for each of these. Call. Do we want to have a person on the end, or we want to make it a robocall? What do you want to do? What do you guys like? You like a robocall of the right time to leave?
I'd say it would depend on the complexity of the condition.
Ah, yeah. So that's a really great point. In the complexity condition, I would contend that we're going to be dealing with patients with all different kinds of conditions. So I would say no robocalls. We have to have people talking to people to make this successful. Because if we have robocalls and it's complicated, or they have questions, we don't give them clarity on exactly what bus to take and what time to be there when it's time to get in touch with the patient. We need people. So that's why early on I said sometimes cool technology companies aren't really about the technology. They can often be around the people with the technology assisting them. So I'm going to contend that our new idea, if we're going to use a phone call, which I think we're going to have to use because not everybody is going to have a cool smartphone, we're going to have some people involved with us. We're going to have a small little call center of people that are comfortable talking with patients, helping them figure out exactly how to get on mass transportation, the best route to the hospital, helping them with the link to paperwork in advance. We can't make this just a bunch of software people writing software or an app. We got to have some people in our company, right? So now let's go to hospital. How are we going to get the information out of the hospital? I showed you their scheduling system. And we know, since we had somebody on this call that is actually getting a message in advance that the hospital is running behind schedule, how can we pull this information out of the hospital? This one's actually easier than the patient, I think.
From their scheduling software, I think we can integrate with that.
Mm-hmm. We'll pull it out of their scheduling software. So now to start our new company, we need an expert on our team. So we know so far we need some folks that are comfortable talking with patients. We know so far that we need someone that's an expert in pulling the information out of the hospital scheduling systems. We know that. And we know to build our secret sauce, we need somebody that is comfortable looking at data and figuring out the trends of when hospitals are running late or early. So I've identified 3 types of people we need in the startup team in this company. We need at least 3 people that I can identify. And the 4th one is to write some of the software that we're going to use ourselves, our app. So we need a minimum of 4 people to get this started.
So Arnab, you raised your hand.
I was wondering if the scheduling softwares keep track of how late the appointments were. Good
question. I would say the most modern ones do, but they're not very well. I've got inside information on this because of my knowledge of the industry, but that's investigation that your team has to do to start your company. The answer is the most modern ones do, and they adjust, but the most modern ones are only 5% or less of the industry, of all the hospitals in America. You're going to be dealing with scheduling software that's been around for 10, 15 years that are very static. They have no concept when things are running late. I would investigate whoever mentioned that their hospital called them and let them know that they were running 30 minutes late. I would start there, because whatever they're using is clearly state of the art. And that's where I would start my investigation of exactly what they're using and how it works, where I start figuring out my business. Okay. So on to the next slide here.
Well, and then real quick, I was going to say we can do an AI overlay as well to figure out what days, you know personally that Tuesdays they run half an hour late, but if you build an AI overlay, it could go ahead and let you know and help you with that scheduling a little bit better.
Artificial intelligence is great, but you need human intelligence first before you can make it artificial. So we need someone on our team that can figure out what the trends are in scheduling, and then we can figure out how to write the artificial intelligence or machine learning to automate that going forward. But we got to figure that out ourselves. We've got to put a team together that can sort that out. And when you're starting your company, it's all about the team. We're identifying what technology we need, the team that we need to put this together. We're getting started here on our cool idea, but we got a couple big problems to solve, starting on the next slide. Okay. We need someone to pay for this. Can't build a business without making money. Who should pay for it and why? In other words, who should it be and why should they pay for it? We've got to convince them not only to pay us money, but what benefits does this have to who's ever going to pay us money that they're willing to pay us? So now this is where this gets interesting. Who should pay for this and why? If we can't identify this, we don't have a good idea. It's back to the individual that said, I don't understand how you got a business here. Why is there a business? It doesn't make any sense to me. So why should somebody pay for this and who should it be?
So if the idea is for us to make a software that tells patients how late the hospitals are running, and what like path or transportation method they should use to get there on time. Then, and the hospitals, because of the pandemic, don't want people in their waiting rooms anymore. Wouldn't they be motivated to pay for access to that software that they can use to update the patients?
Who's the they?
The hospitals.
Hospitals. Okay, hospitals. So reduce the risk in the waiting rooms, right? We're in a pandemic. If we get rid of the waiting rooms, we reduce the risk of patients getting infected. What else would happen if we could get rid of the waiting room? What else, what other benefit?
Well, if you're filling out enough information in advance, and let's say you save 15 minutes of administrative time, you can back into what the saving is to the hospital and provide a subscription service that splits the savings between the hospital and the vendor.
All right, so if we fill out enough info advance, if patient fills out enough, patient filling out enough info in advance, split the savings. All right, I'm going to give you another one to think of. Waiting rooms in most hospitals. Small, big.
Pretty big. They can save a lot of space.
Right.
Extra room.
Sure. Think about that. If you could eliminate the waiting rooms, I've seen some facilities where waiting rooms are 15, 20, 30% of the waiting room, of the space the hospital's in the waiting rooms. If we could eliminate the waiting rooms, we could return a ton of usable space back to hospitals. And I don't know about the Phoenix area as well as I know about the Boston area, but Boston hospitals are constantly putting up new buildings here because they're constantly running out of space. And those new buildings are super expensive. So if we could go to the hospitals and figure out that we could return to them 15% of their space instantly that they could use for something else. They could use it for laboratories, patient rooms, new cafeteria, bigger emergency department. That's a giant savings to the hospital because buildings cost big money and hospitals are always putting up buildings. They're constantly building. They're constantly expanding. So our pitch is let's reduce the risk in the waiting room. Let's reduce the patient filling out the form and wasting time. Let's get that done in advance. And let's return your waiting room space for other uses. We'll call it profitable uses. All right. Now we've got 3 reasons for us to sit in front of a hospital executive that is going to write us a big check for our new technology. And we are going to convince that hospital executive that they're going to get a huge increase in space, in time of patient filling out information in advance. And we've taken the COVID-19 risk down, or the next pandemic's risk down substantially, because patients are no longer stuck in those waiting rooms that have been around for over 100 years. This is a pretty cool pitch you can make to a hospital. You can walk in there, this team can walk in there and say, listen, hospital CEO, my new company, a combination of really smart people that talk to your patients and focus on the ones that need to get to your facility, are going to get these patients to your hospital just in time. They no longer need to wait. You can usher them right into the lab, the doctor's office, because we know exactly when you are ready for them. We're tapped into your scheduling system. And by the way, we're smarter than your scheduling system because we actually know how far you fall behind every Wednesday afternoon at 3:30. And we've accounted for that. And in return, you're going to pay us a whole lot of money for my new technology and my people. Are you down for that? I think you're going to get a yes if you can pull this off. But there's one more problem to solve. How do we convince patients to use our idea? As cool as this is, if patients don't actually use this, we've got to give some benefit to them. How are we going to figure this out? And I also am looking at the chat here. We have a question that popped up from Arnob. Does the scheduling software keep track of how late the appointments were? Again, the answer is the most modern scheduling systems do. That's only 5% of the scheduling systems out there. I just want to make sure I answered that. Thanks, Arnob. Sorry about that for repeating myself. Let's go back to this problem though. How do we convince patients to use our idea? What's in it for them?
Arnab, go ahead. You raised your hand.
Well, the patients are saving valuable time in the waiting room. Also, since hospitals already contact their patients through phone calls, texts, and emails, hospitals could just send, I guess, more detailed information through those media.
Yep. Get more info from the hospital that is relevant. Notice my typing skills need a little bit of work. That is relevant to you. That's one. What else is in it for a patient? What can we do to give patients an incentive? How can we get them excited about this software?
They have like less to worry about because everything is laid out in front of them.
Yeah, amazingly, that is a great answer. Amazingly, reducing worry or reducing people's anxiety or reducing how much they have to think about really can have an impact in getting people to use your technology or your service. Less to worry about, easy to get an appointment completed. All right. Any other ideas? I'll throw out a few of my own.
Advertisement.
Advertisement. So if we advertise, what are we going to say in our advertisement?
Well, you'd have the opportunity for better quality with both the physician assistant and the doctors because you're gathering more information in advance. And so the doctor's spending less time asking questions and more focusing on solutions.
So we're going to call this better quality time with the MD and nurse, or we'll more personal. You're going to be able to spend more time actually talking about what your illness is as opposed to them having to gather data from you. Their time is valuable and they want to use it most efficiently, and you as a patient really want to interact with them. You don't want them just filling out forms for you. So better quality time. But I want to go back to the advertisement here. What are we going to advertise? We need one killer advertisement to make this happen. I kind of hinted to this early on, but let's see if you guys believe what I think the killer advertisement is. Use us, and get a $10 off your copay.
So there are also scheduling apps out there that you can easily integrate and that are very cheap. So it'd be great if patients, if they did sign up for this once, could repeatedly go back and schedule online, which would also reduce time for human resources, you know, people actually scheduling over the phone or anything. And it's easier for both the patient and for the hospitals to schedule online.
For the next visit. All right. So we got to get the patients to use our idea, because if the patients don't use this and they still show up an hour early and we don't have a waiting room anymore, now we got real problems. So we've got to convince the patients to get on board with this. We've got to show them that we're going to save them time. We're going to remove their risk. They're going to get more hospital information that's relevant to them. We're going to take a lot of worry away because we're going to get them there on time, just in time. And we're going to make it easy to get an appointment completed because we're going to have all the stuff filled out in advance through us, through either our software or our people that you talk through on the phone. And by the way, if you use this, think of how Uber and Lyft got started, you're going to get $10 off your copay. It's like $10 off of a ride. And when you show up at the hospital, because you've used our efficient product service, better quality time with the doctor and the nursing staff, because they're going to focus on you as a patient instead of filling out forms. And the next time you go online and schedule your next visit, all your information is going to be there. It's going to be even easier for you. Are you in? Are you down? I think that that's a pretty compelling idea for a patient. So we're missing one thing. We need a name. And this is where I sorely fail as an entrepreneur, is that every name for my new company I've come up with has not been a good one, and someone else has come up with a better one. So I'm going to turn to this team now and think about what we're going to do. We're going to eliminate the waiting room. We're going to get the hospitals to pay for it. We're going to use existing technology where it exists and build where it doesn't. We're going to build the secret sauce around when the facilities are ready, really ready for patients and not just their scheduling system. And we are going to offer a great opportunity. Nice. So what is the name of our new business? Who's creative with a name in this team? Somebody's got to have an idea. And there's no such thing as a bad name idea.
Kevin in chat says speed weight.
Speed weight. Ooh. Oh, I like that. Any others? Speed weight. Oh, Kevin, you may want to consider getting the trademark for that. By the way, that is a really good one. Speed weight. Excellent. All right. So we got our name for our company. We've got the people that we need to build the team around. We've got how we're going to get the hospitals to pay for it. They've got the dollars to pay for it. We've figured out how to get the end users to get excited about it, the patients. We've got a interesting idea. Oh, and another one, MediWeight. Hold on. Awesome. You might want to trademark that one too, by the way. So we've got all the pieces you need as an entrepreneur to get started. There's a lot of work ahead of you, but you got all the building blocks of a really cool company. And those two names are killer. Yeah, Arnav, it does mean that you and Kevin are obligated to make this company. I'll be on your board of directors and advise you for a small portion of the stock of the company. Don't worry. It'll be good. It'll all be good. All right. Let's summarize what we've done here today, right? So how to get the new business going. How do we do this? First of all, find a real problem. And we found a real problem. COVID-19 made it very apparent that got to get patients out of these waiting rooms. It's dangerous for the patients. It's not a good idea for the hospitals because it's taking up valuable space and it's risky, but it's really hard to get the patients there on time. Second challenge, figure out what you can use and what has to be new. I spent a little time today and I figured out stuff that's already in place. I looked and I know a little bit about hospital scheduling systems, so I know that you can get some of the data out of it, but we've got to build a few things to sort out exactly that scheduling system for every hospital and then learn how it really performs on a day-to-day basis. We got to build some knowledge around that, right? Figure out who's going to pay you and convince them. In our case, it's the hospital. They're going to pay us and we need to convince them. We got some ideas around that. And then lastly, users are everything, because without users, there's no reason for the hospital to pay you. They'll show up. If you don't have users showing up just in time, they still need a waiting room. Can you capture the users? Can you get people using your technology, your idea? Speed weight, MediWeight, whatever we're going to call it, whichever trademark you guys can get, we're going to call it that. All right. So that is the steps to success. And the piece that isn't on here is you need a team. You can't do this alone. Your team has to have complementary skills. And we've identified a few members of the team. We didn't identify all of them. This is a short session today. We didn't identify everybody, but we identified a few. You're going to have someone working the phones out to the patients that don't or aren't comfortable using an app or have questions and want to talk on the phone. You're going to need an expert in the hospital scheduling systems. You are going to need someone that is comfortable writing the software to tie this all together. And you're likely going to have somebody that's going to have to go sell to the hospitals to get them to pay you money. So you got those 4 people and more. And I'm sure you can come up with a few more that you're going to need. You can't do this alone. So I've been talking for a long time. You guys have been an awesome and pretty interactive group. Let's stop me chatting for a second, open it up, and hear what you all have to say. Are we dumb? Did we do something stupid today? Or did you think we got a chance at making $10 million each in the next 2 years? What do you think? All right.
Well, I'll add something. I think your methodology does a good job of helping people identify what to do market research on.
Mm-hmm.
A lot of times people are very inefficient in doing market research. Either they haven't properly defined the problem, what are the issues, etc. And you have an excellent methodology to identify what are issues that you need to address, including from a competitive analysis standpoint.
So let me ask a couple questions of the folks here. If you were to close your eyes from the students that are out there, and let's look out 15 years from now, do you think you'd be able to find a problem that you run into every day and build a business around it? Do you think in your own mind you're able to find a problem and at least walk through some of this thinking on how you'd put a business around it? What do you think? And I'm going to throw this to Kevin, since he got the greatest name first. So Kevin, what do you think? Think you can do it?
Like just in general,
Yeah.
go through this process?
Yeah.
Yeah. I think it's actually pretty simple once you lay it out like that.
So where would you start? Where would you start? Where would you be the most comfortable starting? You find a problem. Where would you start? You got the find a real problem, figure out who's going to pay, convince them. What do you think you would do? Doesn't have to be in this order. To be fair, you got to find the problem first. The other three you can do in either order. But which one are you the most comfortable? That instead of first, which one are you the most comfortable with, personally?
Out of the other three to start with?
Yeah.
Okay. Probably find users or a payer base.
So you like being on the front side of the business, figuring out how to get them, closing a deal with them, and getting them to sign a contract with you for your new idea. Cool.
Yeah.
All right. Who is comfortable with figuring out what you can use and what has to be new? Who can do the research to figure out, hey, I can use this piece of software here and this technology here, and this set of people over here that have a call center. Who's good at that in this team?
I wouldn't mind doing that.
Oh, excellent. Excellent. All right. And then one other person, anybody strong software developer in this crowd? Somebody knows a couple languages and would be able to figure out how to build an app around this, or at least a website around this. Anybody in the team?
I could also do that.
Oh, okay. All right. So you and Kevin have all the skills needed to get this started, your first business started. So you're ready to go. So the reason why I say that is earlier on this call, I saw him pop in, and I think you guys have had some interaction with Armando Viteri. Do you guys know who he is or see him in any of these? Well, Armando and I have actually done this together. We've actually started a company together. And the hardest thing I can tell you is making sure that you identified your team members and what everybody needs to do. It's really difficult. If you need investors to give you capital to build your business, you got to show them, hey, I got a great idea, but I also have the team to execute on this idea. There's plenty of great ideas out there, but matching it up with a team is really, really difficult. And I'll end this by saying, do you remember the comment I made early on about, what do you do when you have a friend that's always 15 minutes late and how you handle that? And someone said, oh, I either show up 15 minutes late or I tell them 15 minutes early the wrong time. Well, Armando is exactly that person. That's my friend who has never, ever been on time in his entire career. So that's why I added that in there. So now you got a little insight to that as well. All right, we're almost out of time here, and I wanted to open it up for any other questions, comments, concerns, worries.
Arnav, go ahead. You raised your hand.
So a couple of slides back, you said that since I brought up the point of people not wanting to use ambulances because they're too expensive, I should try and come up with an idea for that.
Yes.
Well, one thing I was thinking about was, I guess, kind of coalesce all of this and also add some sort of, like maybe using Waze, for example, like the software you use.
Yep.
To identify the nearest hospitals to the location of the person who is in need of that emergency, and then they could just head there.
So you're going to build the second version of this company with the ambulance side of this. Excellent. Now you're thinking, what's next? Now you're thinking, what's the follow-on? There's always a follow-on to your idea. I love it. I love it. So your first idea is always good. Your second idea is generally better. Your third idea is even better than that. I love the fact that you're using this to come up with your own second idea on top of this. Fantastic. Love it. Write it down so that you don't lose it. And then investigate it. Get your friend Kevin in there and start that business up. You guys could be retired before you're 25 years old. That was my goal. I didn't quite make it. I'm still working on that, but that was my goal. All right. What else? All right. Nothing else. Alicia, take us home.
I love it. Well, thank you, Ron. That was awesome. And that is exactly what you want to be doing when you go through and start creating company strategy, is figure out exactly what problem you're solving, who's going to buy it, how you're going to get it to them, and then, you know, how you can actually make this happen. You know, identifying collaborative partnerships as well is always helpful when you look at companies and how you can benefit from them. So thank you. That was a perfect exercise in building a company. So thank you, Ron. That was great.
Hey, we built a company in an hour and 25 minutes. We got a name for it. We're figuring out who's going to pay for it. We know exactly the people we need on our team. We've done 45 days worth of work in an hour and 20 minutes. You guys are amazing. I compliment you all. Excellent work.
Thank you, Ron. I really appreciate it. Thanks for taking the time and being here today and sharing your advice and expertise and knowledge with us. It is much appreciated, and I'm sure everyone enjoyed it as much as I did. And Arnab says, thank you for the inspiration, and great session from Billy as well.
Hey, I loved it, and I'm going to be keeping my eye on the industry for speed weight or meta weight coming out with their new cool idea to get rid of waiting rooms. I'm all in. I'm going to introduce you to all my hospital clients if you guys can pull this off. Good luck, everybody, and bye-bye now.
All right. Thank you. Take care, everyone. Thanks, guys.